I'm Zachary Bloomgarden, clinical professor in the Department of Medicine at Mount Sinai School of Medicine. I'm a diabetologist. We now understand that really two classes of drugs are needed in treating diabetes. One, drugs that improve insulin sensitivity, and the other is drugs that improve the body's ability to produce insulin. The older drugs in that class were called sulfonylureas, and essentially they caused an uncontrolled increase in insulin production, leading to hypoglycemia and weight gain. The newer drugs in this class are the drugs that act on a hormone, glucagon-like peptide 1 or GLP-1, which increases insulin production in a fashion sensitive to prevailing glucose levels. And so when the blood sugar levels are low, the degree of insulin production is decreased. The DPP-4 inhibitors reduce the degradation of GLP-1, and by doing that, increase GLP-1 levels, particularly after meals, and effectively lower blood sugar concentrations. So because hypoglycemia is such an important issue in the treatment of diabetes, and because it leads to so much difficulty, in general, endocrinologists have moved away from the use of sulfonylureas and have really embraced the use of GLP-1 related drugs with the thought that these provide a boost to the body's insulin production without the downside of hypoglycemia caused by the sulfonylureas. And the DPP-4 drug, Januvia, has been a very important part of that approach. So we now have a new drug approved, Onglyza, or saxagliptin. This drug has been shown to increase active GLP-1 levels in a fashion similar to what had been previously shown with sitagliptin or Januvia. It similarly is an effective drug at lowering blood glucose concentrations. It appears to work in a similar fashion in combination with metformin. The number of studies carried out with Onglyza have not been quite as extensive as those with Januvia, which has been around for several years now, but with the evidence that we have currently available, we can say that this looks to be another effective drug in the same class. And it certainly appears that this class of agents, the DPP-4 inhibitors, is a useful part of our therapeutic armamentarium in treating patients with type 2 diabetes. So the FDA has been extraordinarily cautious over the past few years in delaying the approval of a number of drugs based on what appears to many of us to be rather flimsy signals of possible adverse effect. In the case of Onglyza, there really has been minimal, if any, evidence of significant adverse effect, and that's really been the case with all the DPP-4 inhibitors, the two that the FDA has held up, and the two drugs now that the FDA has approved. So it's not altogether clear to me that the FDA, in their extraordinarily risk-adverse reaction, has been helping us in withholding therapeutic drugs from the treatment of diabetes, given the great importance of diabetes as a cause of adverse outcome. So Januvia is currently used by general practitioners, family practitioners, internists, and endocrinologists as a safe and effective therapeutic agent which can be given without the need for titration and close monitoring for hypoglycemia as often as required with sulfonylureas. I imagine that Onglyza will, in a similar fashion, be found to be useful in treatment of type 2 diabetes with a very effective clinical profile and with a similar lack of evidence of adverse outcome.